There's a wide variety of different kind of issues that we're seeing in relation to NPS use. Firstly, a wide array of kind of physical health issues, such as dramatic weight loss from stimulant NPS use, from people reporting intense chest pains, also experiencing high levels of panic attacks, and we're also starting to see people who are smoking synthetic cannabinoids actually experiencing bleeding from the eyes and other areas of the body as well. What we've also seen in relation to injecting NPS is quite significant injuries, to the point of where some individuals have actually had to have their arm or even their leg, for example if they're groin injecting, amputated.
Other problem that I've been confronted with is the negative effects of these new drugs. Negative effects that can be classified as psychological, physical and social, I would say. From a psychological point of view, many people that I've known and I've talked to told me about psychosis, which develops much more easily and much more rapidly than in the case of a prolonged use of other heavy drugs such as heroin or amphetamines. From a physical point of view, many people have lost their limbs because of heavy use of methadone, or as it is called in Swansea, meow or MCAT. So that's another negative effect, a physical negative effect, and also a more social negative effect, such as an increased involvement in criminal activity of people who are using this.
Well, we work across West Wales at the minute, and we're seeing more NPS referrals coming in with our young person service, and we've been noticing kind of an steady increase over the last 18 months of young people being referred in quite often from hospitals where they've been admitted having experimented for the first time possibly, or have had a bad reaction from an NPS that they would normally go to. They'd be buying over the counter over the internet.
I think here in Swansea there are a number of trends we're seeing down at the place. First of all, we're seeing that NPS are particularly potent substances. There's been a recent report that's come from King's College in London and with the Global Drug Survey that suggested that if people take synthetic cannabinoids, then they're 30% more likely to need hospital treatment than perhaps if they were to take something like skunk. It's expected come the end of this year that percentage might actually rise to 50% more likely. I think in with that as well, we're seeing perhaps that people taking these substances, they're polydrug using and they're probably quite unaware of that. So for example, in a lot of NPS there are between 2 to 3 active compounds, and in the case of synthetic cannabinoids we've got a psychoactive chemical, we're spraying it onto plant-based material, and that material itself might be psychoactive. So again, you've got a whole range of chemical combinations that perhaps people aren't expecting.
I think the issues we've seen have changed over the last couple of years. There was a time when we had a lot of young people, particularly the younger end of our age group, so we work with 11 to 25 and maybe certainly 13 to 15s, who were almost using that as a gateway into doing something that was illegal, that although it had the name legal attached to it at the time as a legal high, and that both gave it a risk element but also a credibility element in some ways, as if, and to quote some young people, if it's legal it must be safe, or at least it must be low risk.
In terms of the schools work we've been doing, I still think the issue of calling these substances legal highs, that is quite problematic. In the recent survey we're doing, about 48% of young people, they've said that they felt that legal highs, they're either safer than traditional illicit substances or they're unsure. So that's quite a big proportion. So that idea that legal is safe, it's condoned, and that highs can be everything I wanted, I still think that needs to be challenged.
So one of the steps that's already been in place is educational work, and we need to carry that on. We need to provide factual information to all genres of the public, which will enable us to dispel myths such as legal means safe, or that if people use nitrous oxide they will incur serious harm, which for both of those aren't necessarily true. We also need to provide information to individuals who use NPS of where to go. So if they are experiencing issues, or even if they are starting to think about using NPS, where they can go to get support and more information.
Another way to help people and to raise awareness about the problems of these new drugs would be to make users aware of the existence of Wellness, this testing project, which I think is brilliant at the moment, but I don't think it's well enough advertised for the users, at least. It's a very good harm reduction tool, and also helps people know exactly what they are using, but I think at the moment it's not being advertised and used as it should be. It's a free tool to use, and it's safe as well from a legal point of view for the users. So I think a bigger involvement of staff to address or to advertise the existence and the use of this project would be really useful.
I think it's important really to take this back to basics, really. I kind of truly believe in the idea that knowledge is power. So I think it comes back to informing ourselves about the nature of NPS. And you know, nobody knows everything, nobody's superhuman, but it's about talking to the people that are actually using these substances. They themselves may not potentially be aware of what they're taking, they probably aren't aware of the chemical makeup of these substances, but they're the experts when it comes to how it's making them feel. So listening to them, how are they feeling before, during and after, what's happening, pooling that information together. I think as professionals, sharing that information is really important, and in particular making use of projects like Wedinos. So again, where we can send samples anonymously, they can be analysed, we can then learn a little bit more about the chemical structure. From that, we can then talk to our clients and to other service users and give harm minimisation information that's perhaps a little bit more tailored. In terms of young people in school settings, I think, you know, conducting workshops is really important. So as I said earlier, not just here's some information, here's one perspective, getting them to think, getting them to do kind of risk assessments. Do they think this subject is more risky than other types of substance? So, you know, getting them to use those life skills. And taking it just beyond schools as well. So again, a lot of the homelessness projects, anywhere that kind of young people are really, I think that's really vital.
What we have done over the last 4.5 years is developed a series of campaigns that look specifically at NPSs. From a young person's perspective, we've been developing a campaign for all of this time looking specifically at synthetic cannabinoids, because we find that the bulk of the referrals that are coming in are of young people that are experimenting or using that particular kind of drug recreationally. So the young person's campaign has been focusing on that, whilst the adults services campaign has been looking more generally at NPSs, raising awareness of stimulant kind of drugs, looking at harm reduction messages around those particular kind of drugs as well, and also looking at safer usage if there are service users that are choosing to inject. It's about giving them safer injecting messages around the substances that they're using.
The blanket ban is another facet of the prohibition agenda that the government has decided to use as a way to tackling drug use in this country, and it has been so far been proved as not the best approach towards trying to make people stop using drugs.
Something had to be done. So in terms of what we currently have with the notion of not for human consumption, that needed to be changed. However, this was a really good opportunity for the UK government to introduce a regulated, taxable new psychoactive substance market. This doesn't mean that it would be a free-for-all, that these drugs would be available here, there and everywhere. Ultimately, they would be sold in licensed premises. So if you take the Netherlands, for example, there's no need for a synthetic cannabis market because they got a market where cannabis can be bought from licensed premises, and its users prefer natural cannabis, as well as it being a lot safer as well.
Is that the amount of referrals that we've had since there have been these blanket bans in place for other new psychoactive substances haven't really altered the referral rates. What they have done is change the kind of referrals that we're getting. So we're getting referrals of people that are experimenting or recreationally using drugs that have been adulterated. So we're getting that kind of referral coming in. So I guess a blanket ban on NPSs may lead to something on a bigger scale along those lines, that there'd be more adulteration of the substances and less kind of opportunity to be able to give clear harm reduction measures to people based on the information that we already have to date.
First of all, really would like to see a wide variety of agencies and organisations get on board the Weird Science campaign. So maybe representatives, 1 or 2 individuals, attend the briefing sessions that will be in place throughout 2015, or even actually organisations getting us in and delivering the session as a bespoke course to the whole organisation. So therefore all staff can be as up to date with regards to new psychoactive substances. It would be fantastic to use Weird Science as kind of a platform in terms of increasing the awareness of new psychoactive substances, predominantly to the general public. On the whole, the vast majority of the population only get their information around new psychoactive substances via the news, when unfortunately a young person or an adult has tragically passed away. So we need to get information that is factual, that gives the whole story around new psychoactive substances, and not just that NPS kills all of its users.
I think if there's a positive I really would like to see, it's for those frontline workers to be aware of the issues surrounding NPSs and to be confident in having conversations with young people about the use of NPSs, that it starts to become something, it becomes their normal practice, that if a young person is talking about that they don't shy away because they haven't got the knowledge, but they are equipped to have informed conversations with them, and they feel confident in doing that. And they also feel confident at which points they need to hand on to maybe another service, on which points they maybe need to just bring a little bit of information, knowing what to do and when.
The best outcome would be having people being more aware of the risks involved with these drugs, making people aware of the existing tools that they could use to make their drug use more safe, and also having people, especially policy-making people, people who are in policy-making position, to make them aware of the realities on the ground, so having them know the problems that drug users are facing, having the opinion of the drug workers as well who are working with drug users. So any kind of advertisement of the real issues would be beneficial, and if this project will be able to deliver that, I think it would be really, really good.
We'd like to see the targets hit of seeing 2,000 service users via the campaign and at least 400 professionals. We'd like to smash those targets and just make sure that we've got good messages out to throughout the whole of South Wales about NPS and harm reduction messages in particular.
There's a lot of stories, there's a lot of reporting in the media, and kind of sometimes things can be blown out of proportion. They want to sell stories, and sometimes that can be quite frightening, particularly for people perhaps that are caring for young people, whether as a parent, as carer, or people that are supporting young people. So what I'd hope from this campaign really is we can kind of see past a lot of that potential propaganda and actually look at the facts, what's happening, what are people actually experiencing, and potentially with professionals coming together, to create kind of innovative new practices, to put protocols in place. So for example, if I'm working with an under 18-year-old that's dealing with withdrawals from MPS, then what can other services do to help support that from different aspects, be it mental health, be it physical health care, be it diversionary activities. So a pooling of resources, new practices, but also hopefully taking away some of the fear and stigma by actually talking and finding out some factual information.